Hello, this is Celeste Rodriguez.
Imagine you're at your local clinic for a checkup. You finally hit 13 weeks. You're waiting for the doctor to come in and tell you everything is going well. Your baby is healthy, but that's when you get the news. Your doctor tells you that your diabetes is causing for a hard pregnancy. She tells you if you keep going to full term, at this point, you are at high risk of death and the death of your baby. She had suggested an abortion. At this point, you're just freaking out. She gives you pamphlets and reassures you it's your only main option. Your doctor walks out. It's just you and your unborn child in the room now. You pick up the pamphlets. You see the cost for an abortion at 13 weeks, $650. You know there's no way for you to be able to afford that right now. You realize you need the procedure like yesterday. You grab your phone and start to research. Then you find a possible solution. You know what you have to do. Have you ever thought of the possible outcomes after having an abortion? How it changes a female's life forever. Take into consideration to the most dangerous type of abortion, self-induced abortion at home. A self-induced abortion is an action that is taken without medical consultation or assistance. Many call it DIY abortion. Extreme, right? As I have done extensive research proclaiming to this topic, I am qualified to speak upon this topic. I am to believe this topic is very relevant to my audience because many students don't know the risk when it comes down to having this procedure. As an illustration to this speech, I will be discussing how self-induced abortion should indeed not be an option. For example, in some cases, women cannot carry their child to full term. They are at risk to death for themselves and their unborn child. When my Thea was younger, she was pregnant with her second baby. One afternoon, she found out she had a condition that if she kept Thomas, she would lose her life, her sons, and she'd be leaving my Theo, her husband, and her first son, Jacob. She had to make the hardest choice, her and Thomas, or the family she had then. She chose her life and her family's. When I got insight to my Thea's situation, she told me she did the oral misoprostol method. It changed her life forever. Although my Thea did not become crucial due to doing it on her own, she did indeed have more trouble having kids afterwards. She had 2 other miscarriages after Thomas. Although self-induced abortion at home can be very risky, for example, faulty drug regimens, not having a provider to ask questions, and not having clinical assistance could indeed factor with the dangers of the abortion procedure. In fact, Informa Healthcare Country of Publications have a case of a 34-year-old woman who indeed self-administered 10 tablets of oral misoprostol to terminate an 18-week pregnancy. She had expelled the fetus the following day. Although, a week later, she developed excessive vaginal bleeding and difficulty in breathing and tachycardia. She was hospitalized and diagnosed with sepsis due to a retained placenta. Uterine curtilage and aggressive conservation management, followed by a total abdominal hysterectomy, it failed to stop the septic process. The patient's condition deteriorated rapidly, and she died 15 hours after admission to the hospital. As in that case, some women are impelled to self-induced abortion in order to terminate unintended pregnancy due to limited access to the services because some women are socially disadvantaged. In addition to the case I mentioned, according to Informa Healthcare Country of Publication, socioeconomic barriers prevent women from seeking safe abortion services. And meaning, abortion is illegal in many countries, and with unintended pregnancy, high life-threatening complications, and unaffordable appointments, women are stuck in a hole. Stated by Guttmacher Institute, legalization of abortion allows women to obtain timely abortions, thereby reducing the risk of complications. In 1970, 1 in 4 abortions in the United States took place at or after 13 weeks gestation. In 2015, 91% of abortions were performed within the first trimester, with 65% performed at or under 8 weeks gestation. Access to safe and legal abortion is vital to women's health and a well-being. With that, here is another case stated by David Kerr in Pennsylvania. A woman received a 9 to 18-month prison term for helping to end her 16-year-old daughter's pregnancy by giving her the pill that she purchased online. The mother, Jennifer Ann Whalen, told authorities she couldn't find a local clinic to perform the abortion, and the daughter did not have insurance to pay for the hospital stay. Because of the laws behind abortion, many women feel helpless when they are in situations of being pregnant and not being able to resolve what they can't handle safely and quietly. They feel the need to use harsh methods. Abortion can impact the woman's life emotionally and physically. Pregnancy-associated deaths in Finland 1987 to 1994 indicates that the pregnancy-associated homicide rate for women having an induced abortion is significantly higher than for women who deliver their pregnancy. Directed to mortality trends, the physiological impact on the mother, the impact of illegal abortions, and the complications on abortions will lead to increase of illegal abortions, and complications on abortions will lead to increases in unwanted pregnancies and illegal abortions with their inevitable complications. These issues place emergency medical and physicians in the center of the policy debate. Although there is limited research about self-induced abortion in the United States, women have been performing them for generations. I will slightly mention a clinical self-induced abortion process. Listen carefully. You take 2 pills over a period of 1 to 3 days. You will experience heavy bleeding and cramping for a few days, although the process itself takes about 1 to 5 hours. Follow-up calls or appointments are required even to remove the placenta when not followed out by itself. And spotting lasts for over a week. If longer and heavy, call or go visit your doctor immediately. As you hear me speak of this process, you realize this process causes the need of it being with medical assistance. Self-induced abortion at home is the opposite. According to International Journal of Pharmacological Research, unsafe abortions contribute to 8% of maternal mortality. Easy availability and rampant use of medical methods of abortion led to upsurge in self-induced abortion related to complications. In conclusion, many women don't study on this form of abortion. They see it as the only way in some situations. Having an abortion that is performed by yourself is one of the most dangerous procedures they have out there. Many women don't understand if it's your choice and option to have an abortion. At least don't risk your own life for it. You need to ask for medical assistance.